How to reduce high blood triglycerides. 1. What are high triglycerides and why do you need to reduce them? Triglycerides are a type of fat in the blood that stores energy. Normal levels: 150 mg DL, high 499 mg DL, very high, Chesos 500 mg DL. Harmful effects when high: increased risk of heart disease, stroke, pancreatitis, and metabolic syndrome. Causes: diet high in sugar, saturated fat, obesity, lack of exercise, alcohol, medical conditions, diabetes, hypothyroidism, or genetics. 2. How to reduce blood triglycerides. Adjust diet. Reason: diet directly affects triglycerides, especially sugar, refined starches, and saturated fats. How to do it. Reduce sugar and refined starch. Limit sugar: 25 g's day, candy, soft drinks, white rice, white noodles. Choose whole grains, brown rice, oats, quinoa. Increase healthy fats. Eat fatty fish, salmon, sardines, mackerel. 2 to 3 times week, rich in omega-3, reduce triglycerides. Use olive oil, avocado, nuts, walnuts, almonds instead of animal fat. Increase fiber. Green vegetables, broccoli, spinach, low-sugar fruits, apples, pears, lentils, 25 to 30 g fiber day, help reduce fat absorption. Limit saturated and trans fats. Avoid fried foods, red meat, margarine, processed foods. Bao, sample menu. Breakfast: oatmeal plus nut milk plus berries. Lunch: grilled salmon plus green salad plus brown rice. Dinner: tofu plus boiled broccoli plus vegetable soup. Note: avoid eating late at night. Divide into 3 to 5 small meals day to stabilize blood sugar. Reduce alcohol consumption. Reason: alcohol causes the liver to produce more triglycerides, especially in sensitive people. How to do it. Limit as much as possible. No more than 1 glass day, women, or 2 glasses day, men. Replace with filtered water, green tea, or unsweetened vegetable juice. Note: people with very high triglycerides, their 500 mg DL, should completely abstain from alcohol. Increase exercise. Reason: exercise reduces triglycerides by increasing fat breakdown and improving metabolism. How to do it. Cardio: walk briskly, jog, cycle, swim. 30 minutes day, 5 days week. Heart rate 50 to 70% maximum, calculated by 220. Age. Strength training: lightweight lifting or full-body exercises 2 to 3 times week to build muscle, reduce fat. Yoga: cat-cow pose, bridge pose, 2 to 3 minutes pose to improve circulation. Note: start light, gradually increase intensity. Consult your doctor if you have heart disease or very high triglycerides. Weight loss. If overweight. Why? Losing 5 to 10% of body weight can reduce triglycerides by 20 to 50% in obese people. How to do it. Reduce 500 to 1,000 kcal day by eating less starch, increasing vegetables, lean protein, fish, eggs, beans. Combined exercise: 150 minutes of cardio, week, plus 2 strength training sessions. Monitor BMI, target 18.5 to 24.9, and waist circumference, 80 cm for women, 90 cm for men. Note: avoid losing weight too quickly. 1 kg week. Consult a nutritionist if necessary. Control blood sugar. Why? High triglycerides are often associated with insulin resistance and diabetes. How to do. Eat low glycemic index foods, low GI, green vegetables, beans, whole grains. Check blood sugar regularly, especially if at risk of diabetes. Stay active to increase insulin sensitivity. Note: people with diabetes need to consult a doctor to adjust their medication and diet. Supplement omega-3 and support substances. Reason: omega-3 reduces triglycerides by reducing production and increasing fat breakdown. How to do: food: eat fatty fish, salmon, mackerel, 2-3 times a week. Supplement: fish oil or omega-3 capsules, 1 to 2 grams a day containing EPA-DHA, as prescribed by your doctor. Other: green tea, 1 to 2 cups a day, contains catechins, which help reduce blood fat. Note: do not use high doses of omega-3 if you are taking blood thinners. Consult your doctor. Manage stress. Reason: stress increases cortisol, causing lipid metabolism disorders, increasing triglycerides. How to do: meditate, deep breathe. Inhale for 4 seconds, hold for 4 seconds, exhale for 6 seconds, repeat 5 to 10 times a day. Practice yoga or walk lightly for 15-20 minutes a day. Relax. Read a book, listen to music, or meet friends. Note: if stress persists, consult a psychologist. Get regular health checkups and take medication if necessary. Reason: monitor triglycerides and treat promptly to prevent complications. Pancreatitis, heart disease. How to do: check blood lipids, triglycerides, cholesterol, every 3 to 6 months. Take medication as prescribed: fibrates, statins, high-dose omega-3. If triglycerides, 500 mg DL or lifestyle is not effective enough. Check for underlying medical conditions: diabetes, hypothyroidism, liver disease, if triglycerides are abnormally high. Note: do not take medication on your own. Notify your doctor if there are side effects: muscle pain, nausea. 3. Sample triglyceride reduction plan. 1 week. Days: 1 to 2. Morning: oatmeal plus nut milk plus berries. Lunch: grilled salmon plus green salad plus brown rice. Dinner: tofu plus boiled broccoli plus vegetable soup. Walk briskly for 30 minutes. Meditate for 5 minutes. Drink 2 liters of water. Days: 3 to 5. Morning: unsweetened yogurt plus apple plus chia seeds. Lunch: grilled chicken plus broccoli plus quinoa. Dinner: sardines plus asparagus salad plus bean soup. Practice yoga, bridge pose, for 20 minutes. Replace coffee with green tea. Days 6 to 7. Morning: oatmeal plus nut milk plus pear. Lunch: mackerel plus spinach plus brown rice. Dinner: vegetable soup plus lentils plus pickles. Walk for 30 minutes, check your weight, schedule a blood lipid test. 4. Benefits of reducing triglycerides. Reduces the risk of heart disease, stroke, and acute pancreatitis. Improves blood pressure, blood sugar, and cholesterol. Increases energy, reduces fatigue, improves weight. Prevents metabolic syndrome and diabetes complications. Important notes. Consult your doctor. Before changing your diet, exercise, or taking medication/supplements, especially if you have an underlying medical condition, diabetes, liver disease. Be patient. Lowering triglycerides takes 4 to 12 weeks with a healthy lifestyle, regular testing to evaluate. Monitor your body. Stop foods, supplements if they cause allergies, stomach pain, and see a doctor. Avoid extremes. Do not completely abstain from fats or carbs. Need to balance nutrition. Unusual symptoms. See a doctor immediately if you have severe stomach pain, nausea or jaundice, signs of pancreatitis or liver disease. Thank you for watching the video. Wishing you and your family health and happiness.